Welcome back to Dr. Welling Insights, where we help you understand and decode the critical warning signs your body sends as you age. I'm Dr. Welling, and today we're discussing something that millions of people over 60 experience, but often dismiss as a normal and inevitable part of aging: unsteadiness, dizziness, and balance problems. Feeling unsteady, experiencing vertigo or dizziness, or losing your balance isn't something you should accept or ignore as an inevitable consequence of getting older. These sensations are your body's way of sending urgent messages that something needs attention. They can indicate problems ranging from minor and easily treatable conditions to serious medical conditions that require immediate evaluation and treatment. The encouraging and empowering news is that once you understand what's causing your unsteadiness, you often have multiple options to address it and regain your stability, confidence, and independence. By the end of this comprehensive video, you'll understand what causes balance problems and unsteadiness after age 60, what serious conditions can present with these symptoms, what warning signs require immediate medical attention, and what you should do if you're experiencing these concerning issues. This information could literally save your life or help you prevent a catastrophic fall that could change your life forever. If you're over 60 yourself, or if you care about someone who is, please watch all the way through to the end. And if this information helps you understand your health better, subscribe to Dr. Welling Insights so you don't miss future videos about aging, health, longevity, and disease prevention. Before we discuss specific causes of unsteadiness and balance problems, let me explain how your balance system works and why it becomes increasingly vulnerable as you age. Understanding the mechanism helps you understand why balance problems are common and why they can usually be fixed. Your balance system is remarkably complex and intricate. It's not just one single thing. Instead, your body uses input from multiple different systems, all working together in coordination. Your inner ear, which is located deep inside your skull, contains structures called the semicircular canals and the vestibular system. These structures contain fluid and tiny sensory hairs that detect movement, acceleration, deceleration, and head position. This vestibular system sends signals to your brain about which direction is up, which direction is down, and how your head is moving in space. This system is your body's gyroscope. Your eyes and visual system also contribute significantly to balance. Your visual system detects the position of your body relative to your surroundings. If you're leaning, if you're about to fall, if you're on uneven ground, your eyes help your brain understand your position in space. Your proprioceptive system, which involves sensory receptors in your muscles, joints, and tendons, tells your brain where your body parts are positioned in space without you having to look. It's your body's internal GPS system. Your cerebellum, the part of your brain that coordinates movement, processes all this sensory information from all these systems and coordinates your muscles to maintain balance and upright posture. Your skeletal muscles, particularly your core muscles, your leg muscles, and your hip muscles, maintain your upright posture and adjust your body position to stay balanced when you move or encounter challenges. All of these systems have to work together perfectly for you to maintain balance and avoid falling. As you age, each of these systems gradually changes and becomes less efficient. Your inner ear's sensory structures become less sensitive and responsive. Your vision might become blurrier, or you might develop vision problems like cataracts or macular degeneration. Your proprioceptive receptors become less responsive and send less accurate information. Your cerebellum's processing might slow down slightly. Your muscles become weaker due to age-related muscle loss called sarcopenia. Any one of these age-related changes can affect balance and increase fall risk. When multiple systems are affected simultaneously, balance problems become significant and noticeable. This is why balance problems and unsteadiness are common after age 60. Understanding this helps you understand that balance problems aren't just you being clumsy or weak or careless. There's usually an underlying cause that can be identified and often successfully treated. The first major cause of unsteadiness and dizziness after 60 is an inner ear problem called benign paroxysmal positional vertigo, commonly abbreviated as BPPV. BPPV occurs when tiny crystals of calcium carbonate, called otoliths or canaliths, in your inner ear become dislodged and float freely in the fluid of the semicircular canals. When you move your head in certain directions, these crystals move, creating false signals to your brain about head movement and motion. Your brain thinks your head is moving or spinning even when it's not, or it thinks your head is moving in a different direction than it actually is. This creates intense, often frightening vertigo, a sensation that the room is spinning violently around you. The episodes are usually brief, lasting anywhere from a few seconds to several minutes. BPPV typically causes sudden episodes of spinning vertigo that are triggered by specific head movements, like rolling over in bed, looking up at something, bending forward, or looking down. Between episodes, when you're holding your head still, you feel completely fine. BPPV is incredibly common, especially in people over 60. It's often the result of a previous head injury, but sometimes it develops without any clear cause. The good news about BPPV is that it's very treatable. A doctor or physical therapist can perform a specific series of head movements called the Epley maneuver, or canalith repositioning procedure, which repositions the displaced crystals back into their proper location. This treatment is highly effective and often provides immediate or near immediate relief from symptoms. Some people might need the procedure repeated a few times, but it works for the majority of people. If you experience sudden episodes of spinning vertigo triggered by specific head movements, BPPV is a strong possibility worth discussing with your doctor. The second major cause of unsteadiness and dizziness after 60 is vestibular neuritis, which is inflammation of the vestibular nerve, the nerve that carries signals from your inner ear to your brain. Vestibular neuritis usually develops suddenly, often following a viral infection like a cold or flu, though sometimes no clear trigger is identified. You might experience sudden severe vertigo, nausea, and vomiting, and difficulty with balance. The vertigo is usually constant rather than episodic, and it can last for days or even weeks. You might feel safer holding on to something or staying still, as movement makes vertigo worse. Vestibular neuritis is often self-limited, meaning it gradually improves on its own over time, but the recovery process can take weeks or months. During recovery, physical therapy with specific balance exercises can help accelerate improvement and prevent falls while your vestibular system is recovering. Your brain has the remarkable ability to compensate for vestibular loss through a process called vestibular compensation. If you develop sudden severe vertigo that lasts for hours or days, vestibular neuritis is a possibility that should be evaluated by a doctor. Your doctor might give you medications to reduce nausea and vomiting while your body recovers. The third major cause of unsteadiness and dizziness after 60 is cervicogenic dizziness, which is dizziness caused by problems in your neck. Your neck contains many sensory receptors in the joints, muscles, and tendons. These receptors contribute to balance and spatial awareness. When you have arthritis in your neck, muscle tightness in your neck, or misalignment in your neck vertebrae, these sensory receptors send incorrect or conflicting signals to your brain. You might experience dizziness, unsteadiness, or a sensation of your surroundings moving slightly even though you're standing still. Cervicogenic dizziness often develops gradually and might be associated with neck pain, stiffness, or reduced range of motion in your neck. It's common in people who spend hours at desks in poor posture or who have had neck injuries. Treatment typically involves physical therapy focused on the neck, improving posture, addressing muscle tightness, and treating the underlying neck problem. If your unsteadiness is accompanied by neck pain or stiffness, cervicogenic dizziness is a possibility worth exploring with your doctor or a physical therapist. The fourth major cause of unsteadiness and dizziness after 60 is orthostatic hypotension, which is a drop in blood pressure when you stand up from sitting or lying down. Normally, when you change position from lying or sitting to standing, your body's blood pressure regulation system automatically adjusts your blood pressure to maintain consistent blood flow to your brain. Your blood vessels constrict slightly and your heart rate increases slightly to compensate for the position change. But in orthostatic hypotension, this regulatory system doesn't work properly. Your blood pressure drops when you stand, reducing blood flow to your brain. Your brain doesn't get enough oxygen temporarily, which causes dizziness, lightheadedness, and unsteadiness. You might feel dizzy or faint for a few seconds or minutes after standing. Some people experience falls or loss of consciousness if the blood pressure drop is severe or prolonged. Orthostatic hypotension becomes more common with age and is even more common in people taking blood pressure medications. It can also be caused by dehydration, anemia, heart problems, or certain medications. The treatment depends on the underlying cause. If it's medication related, your doctor might adjust your medication dose or timing. If it's dehydration related, drinking more water helps. If it's anemia related, treating the anemia helps. If it's severe, you might need additional treatment like medications that help regulate blood pressure. To prevent orthostatic hypotension symptoms, stand up slowly when getting up from sitting or lying down. When you're sitting, stand up gradually rather than jumping up quickly. Sit for a moment before standing. If you feel dizzy after standing, sit back down immediately rather than continuing to move. Maintain good hydration by drinking water throughout the day, especially if you're on blood pressure medications. Wear compression stockings if your doctor recommends them, as they help push blood back to your heart. The fifth major cause of unsteadiness and dizziness after 60 is medication side effects. Many medications, particularly those that affect the nervous system, can cause dizziness and balance problems. Blood pressure medications can lower your blood pressure too much, causing dizziness and unsteadiness. Medications for anxiety, depression, or insomnia can affect balance and cause dizziness. Pain medications and sleep medications can cause dizziness and impaired coordination. Antihistamines used for allergies can cause dizziness and drowsiness. Even medications that seem unrelated to balance can sometimes have dizziness as a side effect. If you developed unsteadiness after starting a new medication, the medication might be the cause. Don't stop taking your medication without talking to your doctor, but definitely mention the symptom. Your doctor might adjust the dose, change the timing of when you take the medication, or switch you to a different medication that doesn't have this side effect. If you're taking multiple medications, the combination or interaction might be causing dizziness, even if individual medications wouldn't. Your doctor can review your complete medication list and help determine if this is the issue. The sixth major cause of unsteadiness and dizziness after 60 is weakness in your legs, core, and hip muscles. Balance requires strength and power. Your leg muscles have to be strong enough to keep you upright and to make adjustments when you're about to lose balance. Your core muscles have to be stable and strong. Your hip muscles have to be strong and responsive. If these muscles are weak due to inactivity, disuse, age-related muscle loss, or deconditioning, your balance suffers significantly. You might feel unsteady even when standing still. You might feel like you need to hold on to something for support. You might feel unstable when walking, especially when navigating stairs, slopes, or uneven surfaces. The good news is that muscle weakness is very treatable and reversible through exercise and strength training. Strength training focused on your legs, core, and hips can dramatically improve your balance. Even simple exercises like standing on one leg, walking heel to toe, doing squats, or doing step-ups can build strength and improve balance. A physical therapist can design a specific, customized exercise program for your balance and strength. If you feel weak or unsteady, this is worth discussing with your doctor or a physical therapist. The seventh major cause of unsteadiness and dizziness after 60 is vision problems. Your eyes contribute significantly to balance and spatial awareness. If your vision is blurry, if you have vision loss in part of your visual field, if you have cataracts that reduce contrast sensitivity, if you have age-related macular degeneration, or if you have other vision problems, your balance suffers. You might feel unsteady in dim lighting or when navigating busy environments where there are many visual distractions and stimuli. You might feel unsteady when walking on uneven surfaces because you can't see them clearly. You might have trouble with depth perception, making it hard to navigate stairs. If your vision has changed recently, an eye exam is important. Many vision problems are easily correctable with glasses or contact lenses. Cataracts can be surgically removed very successfully. Other vision problems might have specific treatments. Even if your vision can't be perfectly corrected, understanding your vision limitations helps you take precautions to prevent falls. The eighth major cause of unsteadiness and dizziness after 60 is neurological conditions like Parkinson's disease, multiple sclerosis, or peripheral neuropathy. Parkinson's disease affects movement coordination and can cause a shuffling gait, muscle rigidity, and balance problems. Multiple sclerosis can affect balance, coordination, and sensation. Peripheral neuropathy, damage to the peripheral nerves that carry sensory information from your limbs to your brain, can make your feet feel numb or tingly, which impairs your sense of where your feet are in space. This makes balance harder and increases fall risk. Diabetes is a common cause of peripheral neuropathy. Vitamin B12 deficiency is another common cause. Alcohol use disorder can cause neuropathy. If you have peripheral neuropathy symptoms like numbness, tingling, or burning in your feet, this should be evaluated by a doctor. Identifying the cause allows for treatment of the underlying condition. If unsteadiness is associated with other neurological symptoms like tremors, muscle weakness, or changes in coordination, medical evaluation is important. The ninth major cause of unsteadiness and dizziness after 60 is low blood sugar or hypoglycemia. If your blood sugar drops too low, your brain doesn't get the glucose it needs to function properly. You might feel dizzy, unsteady, shaky, sweaty, or confused. Hypoglycemia is particularly common in people with diabetes, especially those taking insulin or certain diabetes medications. If you experience unsteadiness along with shakiness, sweating, rapid heartbeat, difficulty concentrating, or hunger, low blood sugar is a possibility. Eating something with sugar or carbohydrates quickly raises your blood sugar and resolves symptoms. If you experience frequent episodes of low blood sugar, talk to your doctor about adjusting your diabetes medications. If you don't have diabetes but experience these symptoms, your doctor should evaluate you for blood sugar regulation problems, like reactive hypoglycemia. The 10th major cause of unsteadiness and dizziness after 60 is sleep deprivation or poor sleep quality. When you're sleep deprived, your balance and coordination suffer significantly. Your reaction time slows. Your ability to adjust your position to maintain balance is impaired. Your cognitive function declines. You become more prone to falling. Additionally, poor sleep affects your vestibular system and your cerebellum, the parts of your brain involved in balance. When you're tired, your brain can't process balance information as quickly or accurately. If you've noticed unsteadiness developing along with poor sleep, improving your sleep might resolve the unsteadiness. Good sleep habits include maintaining a consistent sleep schedule, keeping your bedroom cool, dark, and quiet, avoiding screens before bed, avoiding caffeine late in the day, and exercising during the day. The 11th major cause of unsteadiness and dizziness after 60 is Meniere's disease, which is a condition affecting the inner ear. Meniere's disease causes episodes of vertigo, hearing loss, tinnitus, or ringing in the ears, and a feeling of fullness in the affected ear. Meniere's disease is chronic and can significantly affect quality of life. Treatment focuses on managing symptoms through diet modifications, medications, and sometimes procedures. If you have vertigo combined with hearing loss and tinnitus, Meniere's disease is a possibility worth discussing with your doctor. The 12th major cause of unsteadiness and dizziness after 60 is anemia, a condition where you don't have enough red blood cells or hemoglobin to carry oxygen throughout your body. When you don't have enough oxygen carrying capacity, your brain and other organs don't get enough oxygen. This can cause dizziness, weakness, and unsteadiness. Anemia is common in older adults and can be caused by iron deficiency, vitamin B12 deficiency, bleeding, or chronic diseases. A simple blood test can detect anemia. Once identified, the cause can be addressed, and treatment can improve symptoms significantly. Now that you understand the major causes of unsteadiness and balance problems after 60, let me explain what you should do if you're experiencing these concerning symptoms. First and most important, don't ignore unsteadiness or attribute it to normal aging. Unsteadiness is a warning sign that something needs attention. Yes, some balance decline is normal with aging, but significant unsteadiness isn't normal and shouldn't be ignored. Second, seek medical evaluation from your doctor. See your doctor and describe your symptoms in detail. Tell your doctor when the unsteadiness started, what situations trigger it, what the sensation feels like, whether it's gotten worse over time, and how it affects your daily activities. Tell your doctor about any other symptoms you're experiencing, like vertigo, dizziness, hearing changes, vision problems, neck pain, neurological symptoms, tremors, or weakness. Tell your doctor about all medications you're taking and any recent medication changes. Tell your doctor about any recent illnesses like colds or flu or head injuries. Tell your doctor about your sleep quality. This information helps your doctor determine the cause. Your doctor might perform an examination. They might test your vision and hearing, check your blood pressure sitting and standing, perform balance tests, and perform neurological testing. They might order tests like blood work, imaging, or specialized balance testing, like video nystagmography. Third, be honest with your doctor about your fall risk. If unsteadiness increases your risk of falling, tell your doctor. Falls are serious at any age, but especially after 60. A fall can result in fractures like hip fractures or wrist fractures, head injuries, or other injuries that could change your life forever. Falls are a leading cause of injury, disability, and death in older adults. To prevent falls and reduce your fall risk, you can make several important changes. Clear your home of tripping hazards like throw rugs, cords, or clutter on the floor. Install grab bars in your bathroom, near the toilet, and in the shower. Make sure your lighting is adequate, especially on stairs and in hallways. Consider night lights for safe nighttime navigation. Wear shoes with good support and traction, rather than slippers or socks. Remove shoes that have become worn out or don't support your feet. Use assistive devices like canes or walkers if your doctor recommends them. Some people are reluctant to use walking aids because they think they indicate weakness or decline, but walking aids are smart tools that significantly reduce your fall risk. Consider balance and strength training exercises. Even simple exercises done regularly can improve balance significantly. Talk to your doctor about whether physical therapy would be helpful for you. A physical therapist can assess your balance, identify specific problems or weaknesses, and design targeted exercises just for you. If you've had a fall, this is definitely something to discuss with your doctor in detail. Even if you didn't get seriously injured from the fall, a fall indicates your balance or strength is compromised. Your doctor can help identify the problem and prevent future falls. Falls are often a sign that something medical needs attention. Consider getting your home evaluated for safety, especially if you're at high fall risk. Some physical therapists or occupational therapists do home safety evaluations and consultations. They can identify specific hazards in your home and recommend modifications. For example, they might recommend better lighting, grab bars in specific locations, rearrangement of furniture, or modification of stairs. These modifications can significantly reduce your fall risk. Another important aspect of managing unsteadiness is regular vision and hearing screening and correction. Your vision and hearing contribute significantly to balance. Making sure your vision is as good as possible and that you can hear well helps your balance and situational awareness. If you need glasses, make sure your prescription is current. Update your glasses if you haven't had a new prescription in several years. If you have hearing loss, consider hearing aids. Modern hearing aids are much better than older generations, and they improve balance through better situational awareness and better ability to navigate your environment. I want to emphasize strongly that while some causes of unsteadiness are benign and easily treated, others can indicate serious, even life-threatening medical conditions. If your unsteadiness is associated with other symptoms, you need to seek immediate medical attention. If you have unsteadiness with facial drooping, arm weakness, speech difficulty, or severe headache, call emergency services immediately. These could indicate a stroke, which is a medical emergency. Every minute counts with stroke. If you have severe vertigo along with hearing loss and ringing in your ears, this could indicate Meniere's disease, which needs medical evaluation. If you have unsteadiness along with fever and neck stiffness, this could indicate meningitis, which is a medical emergency. If you develop unsteadiness suddenly, along with severe headache, confusion, difficulty thinking clearly, or neurological symptoms, seek emergency medical attention. If you lose consciousness or have syncope, seek medical attention. If you have chest pain or shortness of breath along with unsteadiness, call emergency services. Additionally, if you have a fall and hit your head, even if you don't lose consciousness, seek medical attention to be evaluated for head injury. Head injuries can be serious and can have delayed effects. Never assume a head injury is minor without medical evaluation. The information in this video is educational and based on current medical knowledge about balance disorders and dizziness. However, everyone's situation is unique and individual. If you're experiencing unsteadiness, you should see your doctor for proper evaluation and diagnosis. Your doctor knows your complete medical history and can provide personalized recommendations based on your specific situation. Don't self-diagnose based on what you see in this video or any other video. Your doctor is the appropriate person to determine what's causing your symptoms and how to treat them. If you found this information helpful and informative, please subscribe to Dr. Welling Insights. Subscribing helps us reach more people with critical health information that could save lives. Share this video with family members and friends who are over 60 or who experience unsteadiness or balance problems. Your sharing helps spread information that could prevent falls, prevent injuries, and improve quality of life. Leave a comment below if you have questions or if you'd like us to discuss specific balance or dizziness issues in future videos. Your feedback helps us create content that addresses topics important to you and your loved ones. Thank you for watching Dr. Welling Insights, and I hope this information helps you understand your balance, understand your fall risk, take appropriate precautions, prevent falls, and maintain your independence, safety, and quality of life as you age.